Hi everyone, welcome back to my YouTube channel, and today we are going to talk about submandibular gland anatomy. So let's start our topic with introduction. Submandibular gland is one of the three major pairs salivary gland. It is a mixed gland that includes both serous and mucous cells, but it is predominantly serous gland that produce a significant amount of resting saliva. This gland is located in the submandibular triangle of the neck beneath the mandible and has important anatomical relations for surgeons and clinicians. Location of submandibular gland. It is found in the submandibular triangle beneath the body of the mandible. Part of gland is superficial as you can see in the diagram, and part of gland is deep. Superficial gland is present outside the mylohyoid muscle, while deep part of gland is present inside the mylohyoid muscle. As you can see, this is the in mid there is the mylohyoid muscle, and above is the superficial part of gland, and below is the deep part of the gland. These two parts of the glands are connected around the posterior border of mylohyoid muscle. As you can see there, this is the mylohyoid muscle, and the both part of glands are connected around the posterior border of the mylohyoid muscle. Talking about shape and size of submandibular gland. Size of submandibular gland is about walnut size, and it is about 15 gram in adult compared to 3 to 4 gram in of the sublingual gland that is present just in front of it. You can see the size of sublingual gland and submandibular gland. Its shape is irregular with superficial and deep lobes. As we already said, there are superficial lobes and deep lobe that are connected with each other behind the mylohyoid muscle. This gland wraps around the posterior border of mylohyoid muscle. Talking about capsule of submandibular gland, it is a thin connective tissue true capsule. This gland is surrounded by false capsule that is derived from the investing layer of deep cervical fascia. So it has two capsules, that is one is true capsule and the second is false capsule. The true capsule is a thin connective tissue while the false capsule is derived from investing layer of deep cervical fascia. Talking about relation of submandibular gland, we will first talk about the superficial part of submandibular gland relation, that is the larger part. It lies in the submandibular triangle. It is covered by skin, platysma, and investing fascia. The deep part of submandibular gland lies between mylohyoid and hypoglossal muscles. It is lingual nerve loops under its duct hair. And now talking about vessels and nerve supply of the submandibular gland, there is special artery that grooves at its posterior border. Talking about submandibular duct, it has Wharton's duct. That length is about 5 centimeter. Its course is as it arises from the deep part of the gland. It runs forward on hypoglossal and genuglossal muscle. It loops around the lingual nerve. So as you can see, this duct open at the sublingual papilla beside the frenulum of tongue. So this is the duct. You can see this is the opening of the submandibular duct on the sublingual papilla, and it starts from the deep part of the submandibular gland. And this gland is common site for salivary stone, that is silolithiosis, due to long upward course of the duct. Microscopic structure of submandibular gland. It is pseudomucous gland that includes serous acini that predominate in this gland, and it also has mucous acini that are capped by serous ganglions. And this gland produces thick enzyme-rich saliva. Talking about nerve supply of submandibular gland, it has parasympathetic nerve supply that is secretomotor. That means this parasympathetic nerve supply causes secretion from the gland. This parasympathetic nerve supply originates from the facial nerve through the chora tympani. This fiber synapse in submandibular ganglion. Then the other type of nerve supply to submandibular gland is sympathetic nerve supply, that is from the superior cervical ganglion through facial artery plexus, and this causes vasoconstriction. Third type of nerve supply to submandibular gland is sensory nerve supply, that is supplied by the lingual nerve, that is branch of mandibular division of trigeminal nerve. Talking about blood supply of the submandibular gland, It has arterial supply and venous drainage. Arterial supply of submandibular gland is by the facial and lingual arteries that are branches of external carotid artery, while the venous drainage of the submandibular gland is by the corresponding veins that drain into the facial vein. Talking about lymphatic drainage of submandibular gland, submandibular gland drains mainly into the submandibular lymph nodes and then they lead to the deep cervical lymph nodes. Functions of submandibular gland. First function, it is produce about 60 to 70% of resting saliva. Second function, it secrete mixed saliva that is mainly serous type. Third function is that this gland secretion aids in lubrication, digestion as there is amylase there, and also it helps in oral hygiene. Talking about clinical significance of submandibular gland, first is silolithiasis. That is the stone formation in the submandibular gland or in the duct. As stones are commonly formed in the Wharton's duct, that is the duct of the submandibular gland, and it causes pain and swelling at the meal times. Second clinical significance is infection or silodinitis that may result from duct blockage or ascending oral infection. Third significance is tumors, but they are less common than parotid tumors, but they may require excision with care for lingual nerve and duct are also there. Fourth significance is their surgical importance, as their relation with the lingual nerve looping around duct is a key surgical landmark. Conclusion of this lecture video. The submandibular gland is a mixed salivary gland with important anatomical relation in the floor of the mouth. Its long tortuous stalk make it prone to salivary stone, and its proximity to clear critical neurovascular structures like the lingual nerve make its surgical procedure challenging. Understanding its anatomy is essential for dentists, ENT surgeons, and clinicians. And this was all about submandibular gland anatomy. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.